Health and wellness depend on a delicate balance between the mind and spirit and body. Ayurveda is one of the world's oldest holistic healing systems. It was developed thousands of years ago in India. Ayurveda promotes good health but also gives treatments to various specific health problems. In the series Aware and Care, we will analyze the Ayurvedic pathophysiology of certain disorders and diseases, understand cures and prevention management. Welcome to Aware and Care. I am Madhavi Bathula. Our doctor in the house holds graduate and postgraduate degrees and a number of diplomas in various fields of holistic medicine, including Ayurveda, homeopathy, flower remedies, Siddha, naturopathy, and yoga. She's a certified holistic practitioner in the United States. Dr. Ambika Nair, co-founder and chief consultant of Santhigram Ayurvedic Company. Namaskara, doctor. How are you?
Namaskaram. Thank you so much.
We are so thankful for you to joining us this evening and letting us know so much of information about Ayurveda and its practitioner and how to manage various diseases. In 2020, the CDC reported that approximately 1 in 54 children in the US is diagnosed with Autism Spectrum Disorder, most popularly known as autism. 1 in 34 boys identified with autism and 1 in 144 girls identified with autism. Of course, our topic of discussion today is understanding autism, prevention, cures, and management. Dr. Nair, what is autism?
Autism is a complex neurodeveloping disorder. Actually, it is seen, nowadays it is very common in USA and Canada. But, in underdeveloped countries, it's not that much now. That is also there. Because economically, well-oriented people, more cases are coming nowadays. Okay. The normal, in this, the normal functioning of the brain, and because the child will have so much of challenges for this, for the new proper development of the brain. See, you will be standing near the child and talking, but he won't be able to hear that properly.
So that is basically an early development issue, or is it basically?
Yeah, that is actually because this will be autism in 99% of the cases. You will be able to find when they are 3-year-old, like that, 2.5 to 3-year-old.
That early, okay.
That early, because see, people will come and tell like that only because he's not answering. Actually, it is seen mostly in male children, like you told, because I have seen that male children are more affected now than the females. And their communication,
So when you talk about the treatment of autism, I've always heard about it. Please correct me if I'm wrong, that we need to first improve the digestive system, or it is food related. And some people say that it's vaccination related. Do you also often get to hear that from parents?
Yeah, that I will come to that. Okay. Because actually, because see, what is the cause, what is the, see, how people will tell that, how will you know whether this child will have it? Okay. Because when the people will be coming to us, like after marriage and all, people go for honeymoon. But instead of that, they should go and check their, in Ayurvedic style, whether they are, what is their constitution, and treat accordingly if they have any issues. But people don't bother for that. Because if there is any diseases in the uterus, if the semen is bad, any disease was there, so naturally the child will get a genetic disorder. You understand? So the child is bringing it.
So the entire aspect of autism, if you could say, and as we will discuss further, starts before the baby is born, during conception.
Yeah, during conception itself. Because see, if the mother is having any problem with the hormones, if the father had any like a mental agony or any imbalance in the brain, like any sleep disorder or anything like that. So these all, because there will be a big impact on this, the child.
So parents with special children look for ways in which they can improve the child's cognitive and mental development. Other than
Yes.
physiotherapy, people also talk about alternate medicine, and that is Ayurveda, and that is what this program is all about: aware and care, dispel certain myths, talk about facts, and also help people to know how Ayurveda can help certain disorders and diseases. And today, when we're talking about autism, what is your first message to parents who have tried everything about treatments for autism?
See, because actually, you were telling about the like immunization. You understand? See, people come and ask me whether they should take the child for immunization, because in this country, because if you don't take them, the child will not be allowed to sit in the school.
Mm-hmm.
So, if the child is having any problem with the digestion, they should not take the child for immunization, because there is a big impact on that. And the child can, because so many children come to me, because the child was perfectly all right. Now the focus is not there. Now she doesn't listen to us. She doesn't do the commands, so many complaints parents comes and tells me. Because, so, there was, she's from Poland. So even she was fighting here. So she, they joined a big group and they were fighting for this, because we don't want immunization.
Okay.
But the child was then brought to me, then I took care of them, and perfectly all right now, I should say. So, there are so many good treatments also. Then diet was given because the child was having a very strong, immunity issue. So for the immunity, first comes the diet. So they are non-vegetarians, but fortunately the mother was very nice, very understanding. She wanted me to treat the child through the root cause. So, and the child was only like 3.5-year-old. So we took the child, then then I was telling not to eat this, not to eat that. Then she will ask why, So every small thing I want her to she likes me to explain her. So everything was explained, and so milk and milk products we totally stopped. Okay, then shrimp and all, no shellfish, because this all bring allergies. Then no nightshades. Okay, these all
we think that food quality and diet appears to be a very, very important source even during the cure management process for autism.
Yes, it is actually not only in autism, any disease. You understand? When you give the food only, because the food should be the medicine for the child, actually, not only for the child, for anybody, so that you don't need medicines. But we always go for the opposite food, so that is a big issue. Okay, so the junk foods and all. And because you see, what is in autism, what happens in autism is, because the vata, there are pitta, vata, kapha. Kapha, aggravation of the kapha is there. Kapha, and that's it. You see, some children are very heavy. They are not totally autistic, but milestones should be delayed in those children. But they are very stubborn. They will only do whatever they have to do it. Again, they will have repetitive action. This is all vata.
Okay.
So they're like monotonous, they will be repeating the same thing, continuously same thing. So, means to move. He wants to watch the television, means he will be watching that. The same episode they will watch for like 10 times, 20 times, because he likes it. So if you try to change, that will be a big fight in the home. And this kapha vata related means they will be very strong physically. They can attack. So that destruction comes in that. Okay. Then comes the vata, because in this autism it is vata, aggravated vata. Because what they think they cannot do it, because it is not controlled actually. So the vata is so much aggravated because they cannot do anything according to our command or his command, because the vata is controlling them. So that is the toxin controlling them. Let's say whenever somebody comes to us, we tell them to detoxify the body. Then go for because there are so many in panchakarma also. That therapies are there, like in Nasya we do, then Shirodhara we do, then Shiro Basti is there. But very cold places we don't do Shirovasti and all, but in India we do. But here only during the summer we will do that actually, because it calms down a lot. It pacifies the vata a lot.
Mhm.
Okay,
So,
then the means improvement is really fantastic, and I have a quite a lot of cases I am handling these days.
we'll definitely get to more about understanding on that. But coming to the first part of our question and understanding how the basic starts with food. And my understanding of whatever I have seen across friends and family members who have children with autism, they always mention that it is also a challenge to manage their gastrointestinal problems. I think that's where the
Yes.
food aspect comes in. So
Yes.
children are not able to control their food habits. They constantly feel hungry. Some children have more anxiety compared to other kids. And like the way you just explained that there are various aspects to it. So are there different types of autism, the spectrums?
Yeah, because this is all, see, it always differs from person to person. So
Uh-huh.
this is according to the constitution. What
Mhm.
prakriti they are, which is aggravated. Even though vata is aggravated, some days pitta.
Mhm.
Because their cognitive power, some children are very good in that, but understanding, but they cannot do it. You understand? And then they get angry when they cannot do it.
Mhm.
So every person's diet will be entirely different. It will not be the same diet. And even the medicines also, herbal medicines also we give, but it will be totally different actually.
Mhm.
Yeah, person to person. There are so many herbs also available now, because not only that, not now, it is from the beginning.
Mhm.
But like we are seeing the like improvement, and how more people are coming to the Ayurveda now, because
So,
they are more convinced, because no side effect actually. First of all, there is no side effect,
mhm.
and instead of helping, because there are so many side effects of the other medications what these people take,
Mhm.
and they come to Ayurveda, we explain them, we have to make them understand where they went wrong, that correction has to be done,
Mhm.
even though it is very difficult, but we give more time to the parents also to make them understand they have to, it's a big challenge to be with this type of children.
So, Dr. Nair, now when you're talking about, this starts from conception. So, our message to most of the parents who are watching us, who are planning babies, I think they should always go for consultation ahead and understand what are the things they should be preventing, what kind of tests they can do. For parents who've already had kids and who are on the concern level of points where they think that, what is the development issue of a child is having, you have just explained that there is hope here, there is a possibility for treatment. It begins early, and the sooner they reach out to their doctors, Ayurvedic doctors, the development and the cure can begin.
See, Madhavi, these days, people, instead of, like, because so many people come to me
Mhm.
after the marriage, when they are ready for conception, they will come for panchakarma treatment actually.
Uh-huh.
Even 1 week, even 2 weeks, sometimes only 5 days also, because according to their need. You understand? Some people, because they have other issues like backache, any shoulder issues, any, uh, like PCODs or anything like that, then we do treat them in the proper way, maybe 3 weeks. You understand? According to the need. Then, afterwards they go for the conception and they conceive, and there is no anomalies with the children, actually. I can show a lot of children here, actually. Yeah. Because awareness has improved a lot, and people are more aware now that they should take care of, instead of getting children like this and suffering throughout their life. They really care now,
Mhm.
more caring.
So, doctor, when we're talking about autism and early child development, is there also a possibility? Have you seen cases where an autism was underlying, but it pops up after a certain age in teenage or in adulthood?
It's yeah, there are certain cases, because see, till age standard, and then people come and tell me, like till age standard, the child was very studious. So this
Mhm.
is all like a little bit of only autism. You understand? It's not a full spectrum.
Mhm.
Okay. So, like maybe the focus issues and retaining memory issues, and like social behavior.
Mhm.
That is more important. They don't want to get socialized. They don't like to go for parties. They don't want to, like even see it's like a complaint from the, like parents want the child to join the sports. They don't like to go for the sports. Like other activities, cultural activities, they don't like to go for that.
Mhm.
So they come, why he's like this, he's gloomy, either sitting with one, like reading. Some children will be reading only. And like they don't like to read their college books or school books, and fighting unnecessarily, very impatient, and disinterest in the present situation. That's the best way to use. They have no interest. Rest everything they will do. Whatever the parents say or whatever the teachers say, they will never do that. And so restless.
Doctor, the books say that about $461 billion is the expenses incurred across USA for the year 2025. That's the estimate they're talking for the cure or the prevention or management of autism. So physiotherapy seems to be a very important aspect when you talk about it. But so when
physiotherapy is also according to the cases. Physiotherapy is also there. Speech therapy is given. Behavioral therapy is given. There are so many, because now so many things are available. Speech therapy, because see, some children, they cannot articulate the words. So, they really help a lot. So when we do the Nasya treatment and all, and I have seen my children, like whoever comes over there, so their speech improves like anything.
So in this program called Aware and Care, it's only about awareness first, and then of course how to take care of it. So we're dispelling a lot of myths. So they say that when an Ayurveda treatment is being done, the child should not be too active. They should not be too much of sports activities or physical activities. Is it true or false?
No, not at all. Actually, they can be a normal child. There is no problem, because I never tell these people like that. Then the children will never come to us. That to convince them, taking them into confidence and making them understand. And even, like grown-up children, when they come, they don't listen. Then, like you have to really work hard to get into their heart. Then whatever you say, they will listen. So taking them into confidence is a big, like task for me. So, because then they listen, they go, they play, they do everything. But, like food habits, for stipulated time, I tell them not to take like this, because what will be the consequence, I will tell them. Okay, according to the constitution. Okay, that's the thing, and there is nothing like that. And, some people cannot come also, because certain treatments, because what we do, because we're very far. Now, even this corona time, that because I send them oils, I tell the parents to do the oil massage, so that, the body movements are there. It will pacify the vata, and, like they will be able to focus better. And, special oils for the, like head also. So they really can take care. There are so many things they are taking care. And I have a lot of clientele now like that.
So Dr. Nair, when we talk about treatments, of course, everybody tries different phases and different types of treatments. And in America, Ayurveda is also known as alternative medicine. So it's alternate. So there are times when people think of Ayurveda in the end, and there are some people who think about Ayurveda first. So people also fear that what they have been comfortable about for last 2-3 years in certain kinds of treatment. Do you suggest them to completely stop that? Ayurveda also encourages to go hand in hand.
No. Some people will be taking all the allopathic medications, Western medications. When they come to me, we tell them, let your doctor reduce your medication. I never interfere in that. Because whatever, see, from the school, they come with the letter and all. Because now this is the problem, that I won't be able to do anything like that. So what we do, because they will go to the doctor, and the doctor will reduce their medications. Because I had a child, the parents were doctors, and the child was not sleeping for 6 years. Okay, they came to me because there was some problem with the elder child, and they came to me. So the child was cured. So they thought, will you be able to help me also? They told, I will try to help, because I am not God or goddesses. Okay, I always try to help people. Then, like after the treatment, because the child had a convulsion and everything, epileptic also. So with the EEG report, after our treatment, when they went for the EEG, they told that because there is tremendous change. So after 3 months, is all medication what he was taking for like 7 years. They have reduced to like a very, very minute. Then after 3 months, totally stopped. He's doing his master's here now.
That is such a beautiful and such a positive and beautiful story.
Yeah, because they both were Western doctors, because of course they were from India. But like they believed. I don't know why, but they believed. There are so many people who comes to me.
So, doctor, in this conversation, you mentioned about this particular case study and you use the word elder child and second child. So, there is always the fear when your first child has certain health issues, parents fear to go for the second child. So, when it comes to autism, do you think the second child also has high chances? This is again a myth and a fact. What it is, you should explain to us.
No, it's a very good question. Actually, if the genetic disorder is there, there is a chance for that.
Uh-huh.
If it is not a genetic disorder, if it is a metabolic disorder or anything like that, okay, then like there is no chance, because actually I have patients, because cases like first two children were autistic, the third one is normal child, but both the children were like girl babies, then third one is a boy. So everything, every criteria is opposite in this.
Wow.
Okay. So they were very much upset. They thought, because we will not go. But like the child is now 4-year-old. Yeah, but very normal child.
So when the parent comes to know that the first child, the first baby of their home is autistic or any of their disorders are there, they can always go in for the second child, but also go for the prevention method right before conception also.
Yes, they have to go, because if the like all the blood work and all the genetic analysis, everything they undergo, then they come back. Because sometimes when the doctor is over here, but see, fear is another factor. You understand now? People are so much afraid because with one child itself they are tired. Then how they will go for the second child? So convincing them, making them understand. Okay, then like so many people take a chance for the second child, and I am seeing that because like. I'm seeing very promising things, because not autistic.
This is fantastic. And when you talk about a sick child, we are always focusing also on the mother. The mother is the primary caregiver, and the stress factors also affect her a lot. So, what is your advice to these mothers who are handling children with certain disorders?
See,
conditions?
because it is this is another very, very good point you asked me, because not only the mothers, because they are working in, they gave up their job. So many people, they gave up their job just to take care of the child. And some people, because of the financial situation, they cannot give up the job. So they will be working from home. They have to work like there is no wait for that actually. They sacrifice their life for them, these children. And it is very, very, very big struggle for the mother.
We are addressing the mother here. So, what is the message also for the fathers here?
Poor father, because he will be, if the mother is helping, the father will be doing all the other household chores, right?
So, it is a balance work there.
It's a balance. Madhavi, there are so many cases, when the child is like this, so many fathers left the children.
Is it?
Yes, so many divorces happened. Even in my clinic, like more than five or six cases I have seen. I was really shaken on that day because who wants to take that? Even there was a case where when the child was like this, the mother left. So the father came with that child.
So this is a very important part of the conversation that we've come to. We're talking about caregivers and their mental health and their well-being too. But when situations happen like this, where one of the parents has left because they were not able to handle stressful situation of a child with a disorder, so you would recommend mostly both the parents to come together for the sessions, or you say it's okay?
No, they all come, because 99% of the cases, they come together and we tell them that the three doshas. We make them understand what is Ayurveda, what Ayurveda is going to help, where the child went wrong, how you got a child like this. Everything we make them understand. That is the real consultation time. Then counseling. What will happen? Then like points we write and give them to notice that what all the changes you will understand within like 3 months. So they maintain a book only for that, because I don't want them to not on the computer. They will write a book. So the parents, so much they get involved in the child, so they take and they make videos and send me also.
Wow.
Some children, because I can show you all those things, because I can show you. There are so many children like that. See, even like drooling from the mouth, like water. Then afterwards, after the 15 days when they come, or after 1 month they come, they will take the picture and show me how the child is showing now, how much improvement is there, the digestion, no constipation now. There are so many ways. No overeating, but because see, they don't know what is eating. So they won't even tell that whether they are feeling hungry. They don't understand it actually. So whether the tummy is full also, they will overeat. Because the brain is this is a neurological disorder. So naturally, they don't know what they are doing. So they will overeat. So that's why, the like digested food will be there. So that itself become an ama. That is a toxin in the body. So this toxin will make the diseases. Nobody will be able to come out, because any medicine, until unless you release the toxin, you detoxify it and make it, better. Otherwise, nothing will work on your body. It's
Dr.
like
Nair, you will definitely point me at the saying that you're always asking about the time factor, but I guess that is what we are as humans are always anxious about time factor. How long will it take for the treatment? How fast?
Yeah, they will ask me. They will ask me. The moment they will come.
The basic timeline do you think that a parent should be consistent in bringing the treatment?
They must have gone for like 6 years, 5 years, 8 years outside for the treatments. But when they come to me, okay, you tell me in how many days you will make the child better?
Days.
So that's a very good question. Days, not months even. Okay. So I'll tell that let us start it. Okay, then we will see how the child will be. So they come and they continue with the medication. They tell me everything, and I interact with them in a very nice way. Okay, sometimes we have to get angry also to the parents because they are supposed to give more time to the child, right? So there are so many factors involving around these children.
Absolutely. And of course, the well-being of our children is our priority and we will do whatever is required. But of course, a very sensitive question that is coming up is, like you said, they take 6 years, 5 years, try all kind of therapies. And of course, it works at certain levels, but you want the best for your child. So people do talk about the cost factor involved apart from the emotional investment. What is your say on that?
I don't think that it is very costly or anything like that because, of course, in the USA, because in the USA, we cannot buy the things by giving Indian rupees, right? So that is a very big factor where I face every day. Okay. Can we buy the medication from India? Because actually the metal content, whatever the child should take, that should not be allowed. Metal content means again the child will go in a very bad situation. So, so many medicines are available, but it should be through the FDA. I always insist that.
So, but it is a blessing that we have Ayurveda here now as alternative medicine. It is being accepted, and we have resources like you to where parents or people who have any kind of illness or discomforts can come and reach out to. But you say there are questions like this where people come for treatment. And they say we'll bring the medicines from back home.
Yeah, because I give them, because they can buy from anywhere. I have no issue like that.
So traveling, then they will
treatment. Then they will come back. They will tell, no. You give your medication only. Actually, it's not my medication because it comes to the FDA, and everything is there because no other ways.
Okay. So as a follow-up question to that, so traveling is permitted during the treatment, or people have to completely restrain themselves and not travel?
No, it will be like a short period only, like maybe 1 week, because it's a very, it takes time, right? Because it's not like a back pain, you come and take the treatment for 3 weeks, you're perfectly okay. It's not that. So it need like you mentioned, in a short time, we give like 1 week, then, if how the child is responding, then I go for the second week. So if the child is much better means then I go for the third week. Otherwise, I tell them, very worst cases comes to us. So first week we give, then, we tell them to come after 3 months or something like that. But we give the herbal products, like even Gridam, medicated ghee preparations are there. Sarasadam is there. And Gudichadi for the digestion and Inchilegium. There are so many things I told you, because it is according to the constitution. We cannot give every medicine to everybody. Okay. So that helps a lot.
Dr. Ambika Nair, I must definitely mention in this conversation that it is such a sensitive topic, and especially most health conditions, we are a little hesitant to ask certain questions because you're so ignorant about all the aspects involved to it. There are social factors, physical factors, and community factors that come in. But you've explained this all so beautifully and wonderfully. And I'm feeling so comfortable. I'm actually excited to be sharing this episode with many other friends and family members who would be so encouraged to try this treatment. Autism is a neurodevelopment disorder which results in broad range of behaviors and other lifelong impairments. But in today's conversation, I see so much of hope, and so much of hope. Thank you so much, Dr. Ambika Nair. I really want to hear from you, your message to parents in a parting note.
See, because actually, everybody's concerned because cases like that. But, because your investment, that is your time.
Yes.
Okay, that and little medical help, your child will be much, much better. And you know to worry like that.
Absolutely. We have to worry when we have Dr. Ambika Nair right here in our neighborhood. Santhigram Ayurvedic Company is an ISO certified provider of Ayurvedic services worldwide and specializes in Kerala-specific Ayurvedic panchakarma therapies. We were in conversation with Dr. Ambika Nair on Aware and Care. This is a series brought exclusively for all of us. So if you have any questions, please do not hesitate to ping in during your comments or email them. Thank you so much, Dr. Nair. We look forward to our next episode and talking about various other health aspects and management.
Thank you so much.